Good afternoon, dear patients. Today we will discuss a clinical case presented in the picture. These are red spots on the penis. A 63-year-old man came to us with similar spots. In general, the surface of these spots on the foreskin was torn. The spots had been present for about a month, periodically worsening. They were absolutely not related to sexual contact. This man had not had sexual intercourse for a long time. Nevertheless, tests were taken for the main sexually transmitted infections, including the doctor's favorite, Candida. Swabs were taken from the surface of the glands and from the urethra for bacteria and fungi. Tests were taken, a complete blood count, immunoglobulin E, circulating immune complexes, eosinophilic cationic protein to rule out allergies, and tests to rule out diabetes were also done. Accordingly, this patient was found to have neither diabetes nor allergies. No sexually transmitted infections were found either, including Candida. Just so you understand, for Candida, both PCR tests for 8 types of Candida and a separate culture for Candida fungus were performed. Therefore, there was no doubt whatsoever that Candida was not present. Further, in the bacterial culture, streptococci and E. coli were detected. So, accordingly, the diagnosis of bacterial balanoposthitis was made. Balanoposthitis is an inflammatory lesion of the glands, both the glans penis and the foreskin. First of all, antibiotics were prescribed according to the sensitivity of these microorganisms. An enzyme was prescribed as well as calcium gluconate and sodium sulfate in the form of injections. Anti-inflammatory drugs such as Irios or desloratadine were prescribed. Topical lotions and a healing ointment were also prescribed. As a result of this treatment, the patient experienced significant improvement in about 2 weeks. The erosions healed over. At the end of the treatment, there were still some small red spots left where the erosions had been because, after all, at an advanced age, these kinds of rashes heal rather poorly. Regenerative capacity is already reduced, so such small red spots after erosions can remain for quite a long time. The patient was prescribed intensive hygiene and was offered circumcision. However, at such an advanced age, the patient did not want to undergo the procedure. At this point, the patient was discharged from observation. So what can we say here? Well, that you shouldn't always think only about Candida fungus in any kind of lesion. Such lesions are indeed quite common in old age and are associated with the skin's weak regenerative capacity in the genital area, increased moisture, and the large number of microbes that inhabit the urogenital tract, including those microbes that directly cause and sustain prostatitis in elderly people. And accordingly, once they settle on the glands, not just transiently, that is, not temporarily but permanently, they cause inflammatory reactions on the glands and foreskin that are quite difficult to heal and require prolonged anti-inflammatory and antibacterial therapy.